Good morning. Thank you for joining us today to talk about the availability of COVID-19 vaccine for Duval County residents. As we can tell from the high volume of calls the appointment line received when it opened last week, people are very interested in getting this vaccine. And I'm glad to hear that and see that. I understand that residents had trouble getting through on the appointment line that the Department of Health set up for this purpose. Please know that I understand the frustration. But to get through this, I request that everyone remain patient and calm. Local health officials are aware of the issue and are working hard to find a solution as quickly as possible. There is now an online scheduling form that citizens can fill out for an appointment as well. But let's take a moment to look at where we were and where we are today. Back in March, when I declared a local state of emergency in response to this virus, there were so many unknowns about COVID-19. Now, less than a year later, we have a vaccine. That is a remarkable achievement. I'm grateful to the scientific and health community for working tirelessly and quickly to make this and other vaccines available to the public. I'm grateful for our leaders and public servants for getting plans in place to get this needed vaccine to our first responders, medical workers, and vulnerable populations. Though the development process was expedited to meet the needs of this global pandemic, these vaccines went through rigorous testing, studies, and trials to ensure their safety and effectiveness. If you have concerns, please discuss them with your doctor or a trusted medical professional. To assist the Department of Health in vaccinating as many of our neighbors as possible, the city has been working on a plan to provide additional vaccinations. But please understand that we, the city, do not control the vaccine supply chain. Your city has shown the capacity, however, to organize and operate multiple locations addressing COVID-19 concerns. For example, we secured one of the very first testing sites in the country by working with our state and federal partners. We brought our own city-sponsored testing sites online one day later. I'm hopeful we can announce more specific information about additional vaccination locations within the next day or two. It is also my intent to convert 2 of our existing COVID testing sites to vaccination locations as early as next week. This is a promising step forward toward the eradication of this virus, but we have many more steps to take. While we prioritize vaccinations for our first responders, frontline medical workers, and vulnerable populations, it is important we continue our safe practices to reduce the spread. I'm continuing to ask the people of Jacksonville to wear masks, practice social distancing, frequently sanitize hands and surfaces, and all the other precautions we've dutifully engaged in over the last year. Until most of our population get this vaccine, personal responsibility remains our most effective tool in fighting this virus. Now, as you know, the Florida Department of Health is the state agency tasked with administering the vaccine to Duval County residents. To talk more about their progress, patient eligibility, and improvements to the appointment process, I welcome Interim Health Officer for the Florida Department of Health in Duval County, Heather Huffman, to the podium.
Thank you, Mayor. I really appreciate your partnership in this along with JFRD. So I want to tell you a little bit of where we're at with the vaccinations. On December 23rd, late in the day, we were able to receive some of that portion of the 16,000 Moderna vaccines that we currently have in hand and that we've been vaccinating with. Last week and through today, we've also been receiving Pfizer vaccines, about 23,000. So if you add those together, that's 39,000 doses that we've received. This is in addition to what your hospitals have also received in order to vaccinate their staff, including their medical staff and any other staff that would have direct patient care. Again, the process of these vaccines has come out faster than the statewide reservation system that is currently under development. So with that, we have had to go to an alternate plan B, which led to us having the phones line as the appointments originally, which had some issues and challenges, and now we've been able to partner with the Emergency Management JFRD in the city of Jacksonville in order to implement that online appointment system. Again, appointments can still be made when we have additional vaccines at duval.floridahealth.gov. You'll see a link at the top in the yellow, bright yellow highlighted area for making those appointments. We will also put that information additionally out on our Twitter site so that as more vaccines come available, we will put those additional appointments out there. Again, this is appointments only because we must be certain that we have social distancing within the site that we're doing and that we have some kind of efficient manner in which we vaccinate these individuals. We will be getting additional allocations each week. We do not know that number. It comes out each week, and as we get those, we will open more available slots to the community. Currently, we are vaccinating between 850 and 900 individuals a day on appointments. We'll be running that for 3 weeks, and then on that 4th week is when the second dose will come in play for those individuals that have already gotten the first dose, and we will be able to ramp up to double that number, about 1,600 a day at this site. We are looking to open additional sites as we have more vaccine available. As you know, the more sites you open, the more administrative overhead you have as far as staffing, incident command, inventory control. The good thing is that our federal pharmacy partners are online to vaccinate our long-term care facilities. Those include your nursing homes and ALFs with CVS and Walgreens. Those are already happening currently. So all of those most vulnerable residents and the staff members that work with those most vulnerable are currently being vaccinated with the hopes of the 2-dose series being completed sometime in February. And then lastly, I like to always end with the mitigation strategies that the mayor talked about. This isn't the time to let our guards down. This is the time to continue those mitigation strategies, which include mask wearing, hand washing, limiting the amount of distance we have with other people, especially those outside of our households, and not going to large gatherings of 10 or more.